Hi Doug, I'm a new 80-10 tenor whose grandfather was just diagnosed with cancer. He has a bunch of tumors in his stomach. He didn't feel anything weird with him. He was just doing a routine checkup, which he hadn't done in quite a while. The thing is, the doctors are pushing him to do surgery, and I'm trying to convince him to do a detox and have another CAT scan done in a month or two to see if his tumors have shrunk. But they are adamant about it. Can you suggest to me a 100% raw healing detox center which I could send him to? Doesn't matter which part of the world it is. It's hard to get at organic produce over here, so I wouldn't risk treating him myself. I'd rather send him to a place where they can consistently heal cancer patients.
It's a tough situation to watch your loved ones suffer the ill effects that accumulate as a result of their own lifestyle choices, especially if some of those choices were made in innocence or ignorance of the options that might have been healthier ones. It's never easy to watch anyone suffer, and certainly not your own loved ones. I feel for you with that. But there's no one getting guaranteed results healing anything. Okay? The body has to do all the healing. And if we supply the optimum conditions, and the person has the vitality, and they haven't accumulated enough damage, in other words, the degree of damage is not so great as to be irreversible. For instance, nobody's ever recovered from decapitation. The degree of damage was just too great. Then it is possible that even your grandpa may well recover simply by taking better care of himself, by eating 80-10-10, by going through a supervised fast, by certainly by stopping the things that he's doing that are continuing to further irritate or aggravate the situation. A high-fat diet, a sedentary lifestyle, insufficient sunlight. I don't know what the factors are without knowing a fully released history, so I know all the information possible. I can't really make recommendations for care. I don't know the situation well enough. Your grandfather is going to make his own choice. The medical people are going to pose options. You can pose some options, and then you have to trust your grandfather to make his own choices. He's a big boy and he can do that for himself. We have to understand that you're playing against professionals and you're an amateur. The professionals take courses in patient management. Patient management, if you want to understand that, means getting the patient to do what you recommend, whatever that is. Whether that's take drugs, do surgery, have irradiation therapy, or whatever it is that they recommend. The art, science, and philosophy known as patient management is simply a matter of getting people to do what you want them to do in the field of medicine in this particular case. A big part of the way patient management works, or is typically worked, is through the use of fear tactics and rush tactics and threats. So I've had doctors tell patients, if you don't do what I say, I won't be your doctor anymore. You can't come to me anymore. Or if you don't do what we say immediately, then you're going to die. Or things of this nature that are, if you don't take these drugs, there's nothing else going to help you. And this is a tactic. This is management. When we talk about the 5 M's of the modern medical system, management is certainly one of those M's. So I don't know of a facility that claims consistent "we heal cancer." I know many places that say we treat or we care for lots of cancer patients. I don't know any place that says, doesn't matter who they are, what they've got, how bad it is, send them to us, we'll send them home well. That doesn't exist. That's a pipe dream. I can't say that. I've helped lots of people get well from cancer, but I've also met lots of them who are way too far gone before they ever came to me for hygienic care. It'd be really, it wasn't too little care, it was too little time and too little vitality. So if your grandfather would like to talk to me, I'm happy to talk to him. But I would have to know a lot more before I can make any kind of recommendations. Other than healthful living has no contraindications. Stop doing the things that are making you sick. Participate in the things that support health creation. You got to have that going for you, or you're going to go down.